Sian Griffiths, Professor of Public Health and Primary Care at the Chinese University of Hong Kong, also co-chair of the Hong Kong government's expert committee into the SARS epidemic. Professor, thank you so much indeed for your time. Let's just go back, if you don't mind, a few days. Your reaction and the importance and the implications of the US pulling out of the WHO's collective international research.
Well, the World Health Organization is just that. It's a global organization. And if we are serious about really having global control of COVID, we need all countries, particularly low-income countries and countries where the cases are the highest, to get the vaccine. By pulling out of the COVAX agreement, or by refusing to sign the COVAX agreement, the US are doing it going alone. And there are many reasons. You've already cited Donald Trump's antipathy to the World Health Organization, the fact that he's pulling out resources from the World Health Organization as we speak. The World Health Organization is the necessary coordinating body to ensure that we will get the vaccines to the right place. We will avoid vaccine nationalism. We will manage to share the developments that are going on at the moment, and to make sure that the distribution is fair. So COVAX is about equity. It's about a global perspective. It's about actually making sure that the people in need get the vaccine. And by pulling out of it, Donald Trump is undermining the efforts of COVAX, and he's also risking, by going it alone, he's banking on the fact that the US will get the vaccine first, and then it will be able to be available to people in America, and B, will be able to be commercially at a leading edge because it'll be available. So I think there's lots of issues here when you hear that the WHO are being undermined by President Trump's attitude.
You mentioned distribution and you mentioned poorer countries. So let's imagine that a vaccine is found. What about countries that won't be able to necessarily afford all the doses that they require? I mean, I've heard mention that possibly the world will need about 16 billion doses. In other words, 2 for each person on the planet. What about affordability for those poorer countries? But also in terms of distribution and being more equitable, will they get it at the same time, do you think, as the richer countries?
Well, that's where you need this coalition. And if you've got a large coalition who can make the decisions about which countries are most in need, how does it get distributed, that's the key thing. So it's about trying to be coordinated. Richer countries are able to make other bilateral agreements with drug companies. That's absolutely okay. But as they're participating in this shared venture, it will be agreed. The agreements will be from COVAX, who is most in need and how do we get the vaccines there. And there's also more complicated things here because, as you say, there are 8 vaccines currently in stage 3 trials, phase 3 trials. We know that there are many other candidates coming along. It won't just be one vaccine, it'll be many vaccines. And some vaccine producers will be making available at cost or even free vaccines for the poorer countries that can then be distributed through COVAX. So this is about having an international alliance to make sure. Because if we don't control COVID in low-income countries, you stop the trade opportunities, you stop the whole ability for the global economic community to work together effectively.
How much is this a case of everybody having to be safe? Because if it is diminishing in some parts of the world but rising in others, there are many people who say that actually that means that none of us are safe. I saw what I thought was a pretty good example of sort of coronavirus nationalism, which might bleed into the vaccine nationalism. It was from a right-wing columnist in the United Kingdom who said, we only had 2 deaths over the past couple of days here in the UK. Isn't it about time we declared the pandemic to be over? And people piled in on her, health experts, saying, but it's raging in other parts of the world.
It's not only raging in other parts of the world, it's actually going up in the UK again at the moment. We had record number of positive tests yesterday, which puts us on a par with France. And you know the quarantine conditions have been imposed between France and the UK. So you can't say that the vaccine has gone away, that the disease has gone away. What you can say is that the disease is still in the community. We have examples of lockdown across the UK where certain communities, the rates are higher. So the rates are higher in those communities. They're locked down to try and stop the spread. And one of the main things has been spread within houses. So although you can say, well, the rise in cases yesterday was just amongst young people and they're not going into hospital and they're not featuring on the mortality statistics, what you can't say is that those young people, going to visit their grandparents, mixing with other vulnerable people, aren't spreading the disease, and we may see a rise in hospital admissions and in deaths over coming weeks if we don't take this seriously. So the disease is still here. We need to think about it. We need to open up the economy. Yes, we need to get kids back to school, people into the workplace, theatres functioning again, all of those things. But at the same time, we need to remember that each and every one of us has a responsibility within this to wash our hands, to wear our face coverings, and to keep our social distances. And I think those simple messages are the ones that when we did the SARS inquiry, we found that it was the simple public health messages that counted, because there wasn't a vaccine, there weren't any therapeutics. It was actually basic public health. And isolation, once you're tested positive, isolation of the case. Now, developed countries are able to put into place these regimes. They have the capacity to do the testing. They have the capacity to look at a population-wide approach and to take action to help to boost economies. In lower-income countries, it's not even possible to do the testing, and there certainly aren't the healthcare facilities to respond should you get large numbers of people with the disease needing intensive care, and the death rates will start to go up, is what we're seeing in some lower income countries. So we need to think here of equity. We need to think how we can work together. And so even if we get our own countries into a state of control, what we need to do is think about how do we help other countries, because without that, the global economy will suffer.
Absolutely. Professor Sian Griffiths, thank you so much indeed for your time. Take care.